Hi, I'm Phil Talamo, president of PER, and I'm sitting here with Dr. Patrick Borgen, the chair of our Miami Breast Cancer Conference.
Good morning, Phil.
Thank you for joining us.
My pleasure. Happy to be here.
Good. Why don't you start off by telling us a little bit about the field of breast cancer and why Miami is so important?
I think Miami, in its 33rd year now, has never been more important. We are in a renaissance period in the understanding of breast cancer. The rate of change of what we do clinically, of how we put this disease into boxes, of how we predict response, has never, ever changed at a faster rate. I would go so far as to say that there will never be another textbook, old-fashioned textbook, printed on paper, about breast cancer in our lifetime, because the rate of change is too great. By the time you got the book at Barnes & Noble and got home, it would be out of date. So this really makes Miami important. We're going to get an update from 26 of the brightest, most accomplished minds in the world who will have an up-to-the-minute understanding of what we should do for our patients.
I agree. How would you say Miami Breast is different from some of the other breast cancer conferences out there?
Everything about Miami is geared towards our mantra of hear it Friday and use it on Monday. Right. So this is a clinical-based conference. This is like our tumor boards back home. Virtually every one of our 90 lectures has a clinical case thumbnail with a question. What would you do here? We survey our audience, and then the expert in the field says what he or she would do, and then we survey the audience again to see if we impacted their thinking. There is some basic science, but it's basic science that affects our clinical pathways, our clinical algorithms. We have debates. We're going to have 2 or 3 medical crossfire debates. One on, is extended field radiation therapy ready for prime time? One on, does everyone with ER-positive breast cancer need extended hormone blockade? And a few surprise debates in there. We have a massive poster session. We have over 70 posters from 15 countries looking at what folks are doing in other parts of the world. I think all of this in a very social setting. Our faculty loves to interact with audience members. It's our favorite part of this. So in a beautiful hotel, in a beautiful city, on a beautiful beach, we get to talk about what we're passionate about, which is breast cancer, and that makes Miami unique.
Right, and I know there's been a lot of new data that's come out over the past few months.
Yeah, there's no question. When we start the program for next year, which is done the Sunday of the meeting, we leave a dozen or so spots open. And by the San Antonio meeting, we've filled some of them, and ASCO, you know. And so a lot going on, a lot of things being questioned. But mainly what we're talking about is understanding the fundamentals of this massive spectrum of diseases that we simplify by calling it breast cancer. We've always blithely said this is a family of diseases, but boy, we had no idea how big and how complicated this family is. Through therapies, we're learning about the family members. We look at animal model systems and cell lines and sometimes chalkboard models, but until you've given patients these drugs, for example, bevacizumab, blocking blood vessel growth, that should work unbelievably well, and it really doesn't work as well as we thought. But look at the new cell cycle checkpoint inhibitors or the immune checkpoint inhibitors. We're seeing remarkable results that we've never seen before. The challenge for us who see breast cancer patients every day is, how do I know that what I'm doing is right? How do I know that what I'm doing is cutting edge? That's where Miami fits in.
I agree, and I know we were talking a little bit about the abstracts as we were reviewing them earlier today. We really have a good spectrum from across the world. Do you want to elaborate on that?
Yeah, we have a wide range of abstracts, from the case report of something no one has ever seen before, to medical device development, to novel applications of new drugs, to different oncoplastic surgical procedures, different ways not only to place implants, but what they're made of, and how we actually incorporate things like radiation therapy. It really is an extremely diverse group of abstracts.
And they're from all over the world.
15, 16 countries, yeah, amazing. And just talking to doctors from Singapore, What do you face there? The disease is different there, by the way. We know that as women migrated from mainland China to mainland Brooklyn, the disease changed and the incidence went up, but also the fundamentals of the disease went up. And so we have a lot to learn by taking a global view of breast cancer, which Miami does.
Right. So you mentioned a few of the medical oncology topics that are hot right now. What's hot in surgical oncology?
Yeah, everything with surgery has to do with sequencing of treatment. And what I mean by that is we're breaking the dogma of surgery first and then chemo and then radiation. There are so many times when treating a patient systemically first makes more sense. If the surgeons don't buy into that, if they don't embrace it, it never happens. And I'm not just talking about cytotoxic chemotherapy. One of the things we'll talk about this year at Miami is neoadjuvant endocrine ablative therapy, which we have really underused in this country for my whole career. So the surgeon is the quarterback of the team. We're in the middle of football playoff season, and the quarterback really remains the surgeon because he or she is going to set the trajectory. And I think treatment sequencing is incredibly important. We'll hear at this meeting a lot about emerging oncoplastic techniques. We're going to focus on ERAS, Enhanced Recovery After Surgery. We're going to focus on opioid-sparing pain strategies, and we'll even have a satellite session on that where we've got an incredible technology of being able to do a 3D fly through into a cadaver to look at the areas that we're blocking, to look at the planes that we want to hit. So I think there's a lot to offer for the surgeons this year.
Definitely, and it really speaks to the format of the meeting with the general session in the morning, the specialized education with the surgical and the medical track in the afternoon.
Right, it works really well. And then all of the social time that we have the vendors. You have to go through the vendors to get into the main room. We love that. Our vendors are important to us and they offer wonderful products. And our attendees get to meet them and discuss their experience with their products. We have cocktail receptions. We have the Great Lawn reception. You know, Phil, I'm going to join the band this year on the Great Lawn, so I'll be playing with the band. So
What do you play?
Keyboards.
That's going to be fun.
So the band members are already quitting the band, but no, it'll be a lot of fun. So I think Miami is such a unique, there's a unique culture, I think, to Miami. And I think that PER has done a fabulous job of taking the grassroots culture and really expanding it, and in a way, making the information more accessible. This is complicated. My biggest complaint as I travel and give talks is, gee, this is getting really complicated, and it is. But breast cancer is a complicated disease. And Miami gives us a chance to really put it into boxes so that we can hear it on Friday and use it on Monday.
I agree. And I know that we've done a lot of growing with the meeting as well. What would you say to somebody that hasn't been to it in 4 or 5 years?
Yeah, I really would say if you've not been in 4 or 5 years, come in 17, come this March. I think you'll be surprised. I think you're going to learn a lot. I think you're going to have a great time. You'll make friends. You'll see colleagues you haven't seen in years. And you'll go home really knowing that what you're doing is mainstream and is the best possible approach for your patients.
I think so. Do you have anything else you'd like to add?
Nope. I think that PER has done a marvelous job of taking America's best breast cancer meeting and making it better.
Well, thank you. It's been a pleasure working with you over the past few years to do so, and I look forward to a great meeting and having you all join us this year.
Thank you.